Well, good afternoon. Welcome. My name is Dr. Carla Cunningham, and I'm a veterinarian, and we are in Metropolis, Illinois, with Miss Aggie here. And we are going to give Aggie an exam, like would happen if you took your dog or cat to a veterinary practice. And what I mostly take care of now are dogs and cats. I used to take care of cows and horses and pigs, but now I mostly just take care of dogs and cats. And this is little Miss Aggie here, and we're going to give her a good exam today, okay? Now what we're going to start out with for Miss Aggie is a heartworm test. Heartworms are a disease that is spread by mosquitoes, and it's really important for your dog especially to be on heartworm prevention. And when they go to the vet every year, we recommend that they get a heartworm test. So we are going to draw a little bit of blood from Miss Aggie right here. It's a very little needle. She did not flinch. You were very brave, Miss Aggie. Scouts are brave, and Miss Aggie was brave, so maybe she could be a scout, huh? So we're going to take this blood, and I'm going to put it in this little vial right here, and this is called conjugate, and this is what we're going to use to determine if there's heartworms in here. So we're going to put 4 drops, 1, 2, 3, 4 drops of blood, or of conjugate, and 3 drops of blood. 1, 2, 3. Okay, and we'll put it in this little vial, and we're going to mix it up. And then I'm going to place it in this special test kit, and then I'm going to place it in this reader, and it's going to get started in just a minute. And we're gonna watch that as this goes on. But while that's running, I'm gonna go back over here to Miss Aggie, and part of my exam is I'm gonna start with her face, and I'm gonna look at her teeth, and she's got beautiful teeth. I'm checking for any tartar, things that would cause cavities in you, or broken teeth, and hers look perfect. So we wanna make sure that you're brushing your teeth twice a day because a Scout is clean, and her teeth are clean, so she must be chewing some dental chews to keep her teeth nice and clean. So the next part of my exam is I'm going to take this instrument. It's called an otoscope. Right now I don't have the cone on. I'm just going to use it to look in her eyes to make sure they're bright and shiny and clear, and they are. And then I'm going to take this cone and put it on there, and we're going to look in her ears. And I bet your doctor does this to you when you go to the doctor. And I'm looking in her ears for any signs of infection or pain, and hers look perfect, so that's good. Now I'm going to take a stethoscope, and a stethoscope is something that we use to listen to sounds inside of something. And so the most common thing that we use a stethoscope for is to listen to their heart. But I can also use it to listen to their lungs. So right now listen to her heart. I'm going to use my watch to count how many beats she has per minute. And hers sounds really good and strong. I'm going to use it to listen to her lungs. Good girl. And now I'm going to use it back here and listen to her belly. See if there's any, you know how your stomach growls sometimes? That's normal. We're just listening for those sounds, and her sounds completely normal. What a good girl, Aggie. Okay, so I'm going to hang up my stethoscope. So now I'm going to feel her body. You know how when you go to the doctor, he wants to feel your belly, make sure everything feels okay? That's what I'm doing. And I'm also feeling her legs, feeling her lymph nodes, making sure everything feels nice and healthy, and it does. So, I have found Aggie to be perfectly healthy today. We are going to give her one vaccine we're not going to give her a vaccine with the needle. She already got a vaccine, or she already got a blood draw with the needle. So I'm going to give her an vaccine of something called canine respiratory disease. And this is going to protect her from getting things called kennel cough or bordetella when she goes out and plays with her other dog friends. So this has got a special little container or little device on the end. We're going to put that in her nose and stick it in her nose. And she says, oh, well, that was okay. She took that pretty well. And she was such a good girl for her exam that we're going to give her a treat. What do you think? You think you should get a treat? Huh? Okay, easy. Good girl. All right. Well, thank you for joining me today for an exam for Miss Aggie, for her veterinary checkup. And you guys have a great day, and we'll see you down the scouting road.